course that's here in Toronto and people will travel in. Do you want to say a bit more around, you know, if you're hearing from trans people from across the province and what the issues are and what resources exist for them? I think, you know, like with Bill 33 having passed in the spring, and it talks about, you know, human rights and access to services, healthcare services and social services are part of this, and I just am wondering, you know, what is the situation outside of Toronto for trans?
Well, I think because we did have a grant to be able to go out and do this intensive training. There are these oases that are coming along. It's, you know, trans people in some of these places like Ottawa or Windsor would probably still say it's not where it should be, but it's a hell of a lot better than where it was.
Yeah.
And I think it's all a work in progress. We have another round of training that will be going on with Sudbury, Peterborough, Kitchener, and so on. So gradually, you know, there are more places where what we do is we don't just go and train like a few people. We go and train a place that has the capacity to run an interdisciplinary team, because that's really what you need for trans care. You need doctors, you need nurses, you need counselors, you need people who can do groups. So we train on all of those things. So not just how to do the hormones, but how to provide a really decent, comprehensive service. And those centers in turn tend to invite into the trainings other people in local organizations. So what you get eventually is a bit of a virtual team in the region. And what you find is that you get strengths, you know, outside of just one agency. Of course, now what's happening is I think that gender-independent children or gender-variant children is getting to be a very big issue. So as we're starting to get a little bit, you know, further with working with adults, now people are now saying, well, there's nothing around gender-independent children. And that's an area that we're starting to do some work. We've been doing some research through Jake Pine, who some of you might know, and created a fact sheet on gender-independent children, starting to work with quite a large committee of parents and some providers.
There are some great YouTube resources though.
Yeah, yeah, that's right. So starting to try to look at who, again, you know, where could there be some services for families of kids who are really, in many cases, experiencing a lot of distress about their own gender and gender presentation.
Yeah, just put your hand up.
Yeah, do you provide any kind of prison outreach services?
Prison?
I used to work in the prison system. My impression was transgender, LGBT prisoners, especially transgender one, had a lot of problems. My impression is that nothing's really changed in all the years since then.
We don't do direct outreach to individuals, but we have done a bit of work with the justice system. We've had, I mean, very little. I don't want to overstate it, but we do it from time to time. We do get asked to do consultations. Some part of the justice system who came and talked about that, you know, about what about people who are in prison and what about their rights to medical care. And obviously we would try to, you know, provide assistance.
Even things like female hormone, even things like hormonal treatments, so the ones who are on.
Yeah.
Okay.
It's a bit varied. There is a person who calls me actually from one of the jails from time to time. And she has actually been allowed to get hormones and is being put through for surgery even though she's in jail.
Even things like actually being treated as females.
It's very difficult.
Something very conservative guards who tend to resist.
Yes, absolutely. No, I think it's a whole area of training. You're quite right. But our approach would probably be to try to train the institutions rather than do the individual outreach.
You've been mentioning on and off throughout this interview a lot of the innovative kinds of things that RHO has been doing. And I know that RHO will partner with researchers who are doing some really groundbreaking work out there. You're putting out, some really fascinating and new information that just doesn't exist anywhere else. Do you want to speak a bit about that?
Sure. Well, we're very lucky to have all these researchers that are, I think, beginning to actually get funds, and some of them are working on very small amounts of money, but starting to actually look at some very new areas that really haven't been researched at all in Canada. So just to get it right, let me just give you a little bit of a sense. So we've been partnering on a number of research studies that are funded through the Canadian Institutes of Health Research. So one is the Trans Pulse study, which some of you might have heard of. That's the biggest study of trans people's health in Canada. We've been involved in one on pathways to effective depression treatment for sexual and gender minority women in Ontario. That's with Laurie Ross, who's at CAMH. Another one on risk and resilience among bisexual people in Ontario. And that's a community-based study of bisexual mental health, again with Laurie Ross at CAMH. One that you're involved in is the Envisioning study, which is looking both at people in Africa and the Caribbean and India, but also people who are refugees and asylum seekers here in Canada when they're LGBT, and what are they facing here. And then another one that we're involved in is with Dr. Andrea Daly and Judith McDonnell, also at York University, who are working on long-term care. What does it mean to have home care or long-term care, coming into your home when you're older or if you have a disability. So yeah, we've been involved in quite a few of those. We've also been creating a number of fact sheets, and the fact sheets are really like a synthesis of whatever literature there is, particularly Canadian literature, on a topic. And so there's a section in the website again where we've created fact sheets, so you can quite easily see kind of where are things at now. You don't have to go and read the 50 articles, you can get the synthesis and see what's been done on that topic. And that's quite a useful resource both for students or people who are actually studying a topic, maybe for their own study or for a paper, but also if you're writing a proposal for some reason, let's say you're writing a proposal on something like mental health because you want to prove that there are certain issues. You can use the fact sheets, to give you kind of up-to-speed information on a topic. We've got about 13 out, I think, now, 9 or 10 anyway, and we'll be doing about another 7 or 8 each year.
And are they ready to available on the website?
Yes, yes, and everything that we make is downloadable, so you can just print it directly, and then we have a few kind of brochures and tip sheets and manuals and things like that. And we have an online store. So if people want to get the glossy versions of things, like for a waiting room or something like that, they can buy them through the store. We run it just at cost. We charge, but just enough to keep printing. And we have a whole range of products, maybe, 50, 60, 70 products that don't really exist anywhere else. And when we go out and we train people like physicians or social workers, we say, one of the things you could do is put up a poster or put some brochures in your waiting room so that your people have something to know, that you care about their health, that you're here to serve them, that there's something for them.
Great. My last question was going to be about how we work together, but we kind of covered that a little earlier around the issue of curriculum, and we can partner on other issues as well. I'm conscious of time, so I'm not going to get into that at this point, but I want to open it up to the rest of you. Any questions, comments that you have, and even information to share for that matter? Rich?
So is RHO doing anything that was ending LGBT-specific addiction treatment outside Toronto? As you know, Rainbow Services at CAMH has been shown to be very successful with follow-up studies. As far as I know, one of the treatments similar treatment. Something else in
I think it's a very important area, and it's definitely one that we're very interested in working, partnering with organizations. The thing is, we pretty much have to wait to be invited in. So we do actually apply and get into conferences and things like that, because that's sometimes a way to introduce a topic. And then from there, sometimes you get more traction. So whenever we're invited, and we do some in organizations that are dealing with addiction issues, we'll go and we'll do training. And all of our training is really saying to people, you know, you already have skills around, you know, the drugs themselves or tobacco or whatever it might be. Where we would like you to understand is how do you kind of reframe your picture of who you're serving a bit. So we try to kind of marry the skills that they already have with a broader vision of who are queer people, and you know, not to make assumptions, and what are the right questions to ask, and what are some of the background issues, you know, socially, historically, and all of those things, and to help them to understand that we come from all backgrounds. You know, we're not a monolithic group. So always to be thinking that anyone they might see might be queer or might have family members who are queer, and just to always sort of have that on their radar.
There's also from the Rainbow Services and experience unique needs or qualities specific to queer people. It's different from the general population. That's what the same sort of programs, just sort of adjusted for, say, a better sensitivity to queer people.
Yeah.
Aren't as better than nothing, but they're not as effective as a program that's actually geared towards specific needs.
Yeah. And you would hope that is sort of where they'll go. Sometimes all you get is a couple of hours to do training, so you're starting out often at such a basic place. You know, you're starting with literally what are the right words to use and not word use and that kind of thing. So you can get so far into it, and then see if they can pick up from there.
What I'm hearing though is that there's an established agency that already has models for training and that could be borrowed and reused elsewhere. And somebody needs to go to those other mental health agencies and say, hey, there's resources available. Can we start something in this other community? Like, why do you need to be invited in to call someone up? Who can do that calling and making it happen?
Well, actually, while you were talking, I was thinking maybe Camp 8 should be going out and training people on their model, rather than us
That's a
going
great
to do it.
example.
They do actually provide training,
Do
but
they?
it's optional. It's like a training package you sign up for.
Yeah. It's very difficult to force training down people's throats.
I agree with that.
They don't like it.
But it doesn't sound like it's just training, it's establishing new, let's say, an addictions counseling group. So to actually establish the group, yes, you need training, but you need other things too. Right?
And also recognizing that ChemH, especially ChemH Rainbow Service, is very trauma-centric. And what that entails is like our needs, Tony and queers, are kind of different than outside of Ontario. Like for now, like right now, crystal meth is an extreme high, but if you go to other communities, like, and they have that same model where they focus on crystal meth, like that might not necessarily work. So adjusting by working with the community, soon developed like, hey, what does your community do? Rather than, hey, we already did it, we're ready to do it, it becomes sort of such a privilege to stand from like, we are right and we are being all, which could